delegates here present, trade union leaders here present, our gallant nurses and midwives, ladies and gentlemen. I am delighted to address you all at this all-important gathering, marking the opening of our 16th Quadrennial National Delegates Conference. 63 years of our existence as a professional nursing and midwifery association and as a trade union tells the significant contributions the GRNMA has made towards nation building, especially to the health sector of Ghana. Throughout these years, we have had great leaders like Dr. Dosia Kisei, Professor Ayodele Akiwomi, and many others who have led this association with zeal and diligence. Our biennial and quadrennial conferences have always served as a platform for taking critical decisions that guide our operations as a professional association and trade union and informs our governance to ensure we are better positioned to deliver on our core mandate of seeking the socio-economic interests of our members. Prof. Chair, the Ghana Registered Nurses and Midwives Association has held and continues to hold a collective bargaining certificate on behalf of all nurses and midwives in Ghana. As the largest health workforce in the country, our members continue to deliver health services at various levels of the health system throughout the country through clinical practice, research, and innovation. Prof. Chair, ladies and gentlemen, the COVID-19 pandemic has left us with many lessons. It is against this backdrop that we settled on the theme, investing in nursing and midwifery, a strategic response to the right to health for this Congress. Prof. Chair, a number of issues continue to affect the progress of our professions in Ghana and actually impede our ability to provide safe and quality services to Ghanaians. Unattractive conditions of service, including low remuneration, poor work environment due to the poor state of infrastructure of some hospitals and health centers, lack of logistics, including some essential medicines, vaccines, and equipment, and the development of many sub-district communities, resulting in poor housing, bad roads, lack of social amenities, and many others. Indeed, we seem to be far away from changing this narrative within the next few years, and it is a source of worry as a number of our colleagues continue to migrate to the USA, Canada, UK, and other high-income earning countries. It may be clearly evident that we will not attain the targets of the Sustainable Development Goals 3 or universal health coverage by the year 2030, but we must not relent on our efforts to ensure we have a more robust and resilient health system with well-motivated nurses and midwives. It therefore came as a surprise when we heard the Honorable Minister of Finance mention something about vehicle import tax waiver in the budget and mention that government will continue engaging the Ghana Medical Association. Dr. Richard Salome is here. I must say this. You know, it came as a surprise because we have all been working hard towards this. And I remember we had the opportunity to submit a paper to His Excellency at the Jubilee House and called for this. Even along the way when we saw our colleagues moving out of the country, we drew the attention of the Ministry of the importance to let Cabinet know that this waiver can help curb the migration, and therefore it should be reinstituted. It is interesting to note that it was during the His Excellency President Kufuor's time when this waiver was instituted for health professionals. And indeed, if today we have the MPP government in power under the leadership of His Excellency Nanado Dankwa Akufo-Addo, and the waiver is being instituted after the NDC cut it off, then we would have loved to see that it cuts across all health professionals, especially our nurses and midwives who form the majority of health professionals. We are also experiencing the bit about the 13th month allowance, which, as we speak, nurses and midwives have been cut off totally. And we are being told we haven't negotiated for it yet, we should wait until we get it before it is instituted. But that is quite strange, and we see it as unfair labor practice. You know, this money is supposed to be paid from the IGF. Who contributes to the generation of the IGF? It is we, the health professionals, especially with our numbers as nurses and midwives. So if it is coming as a motivation to workers, why will you pay some and leave some? Why will you pay others and leave your nurses and midwives behind? I think this is very unfair, and I want to use this opportunity to call on managers of our various facilities that if you are paying, please don't leave your nurses and midwives behind. It is very important. But I must quickly add that we submitted a proposal for our conditions of service negotiation in August this year, and it actually contained all of these. We've been waiting for the Fair Wages and Salaries Commission to invite us to sit and begin negotiations, but that has not happened. We are still following up with, and we hope that very soon that negotiation will start. In the meantime, the one we signed in the year 2020 still holds, and that is what will be in implementation till we actually sign a new one. What we need, Prof. Chair, generally is improvement in our basic salaries. We need full medical insurance during our service to Mother Ghana and when we retire. We need prompt payment of our Category 2 and 3 allowances and other allowances as contained in our collective agreement. We need support in acquisition of affordable housing and personal vehicles, and that is the more reason why the vehicle tax waiver is very important. But I must say, Prof. Chair, beyond these lamentations and beyond all the effort we are putting in place to ensure that our employer actually makes our condition much better, as an association with the welfare of our members at heart, we have instituted a number of welfare packages to make life easier for our members. These include our loan scheme, our health fund support, which is a non-refundable financial aid we give to members with severe health challenges and accidents, especially those that are outside the National Health Insurance Scheme. We also have in place flood and fire disaster support for nurses and midwives. We have land and housing schemes. And at the moment, all GRNMA regional branches, that is the 10 constituents of the association in the country, have ongoing projects to this effect, using litigation-free lands for housing and land mortgages for members. We also have our free annual souvenirs that we give to our members. We also have in place a scheme to pay the professional identification numbers and the auxiliary identification numbers renewal with the Nursing and Midwifery Council at the end of every year or at the beginning of every ensuing year. We also have in place our annual national dinner and awards night where we motivate our nurses from our own coffers and through the kind sponsorship of some of our long-standing sponsors. We also negotiate on behalf of our nurses and midwives, and the negotiation covers salaries, allowances, and other conditions of service, and of course, workplace policies. We have legal support available where we support our members through medical legal, when medical legal issues arise. We also have in place death benefits on spousal death and death of members. And all members of the association also have access to our guest houses all over the country. And interestingly, some are running as guest houses, some are running as hotels. And members have access to these facilities at a very subsidized price, not like the public rates. And we have personal and auto loans arrangements with Car Bank and Stanbic Bank for members. And we continue to represent nurses and midwives at the international level and, of course, at the local level. So all these are things that are in place to ensure that at least our members as nurses and midwives are a better place. But it is not for us to do everything, especially when it comes to health insurance. It is very, very important, and we will continue to call on the employer to institute this. Health insurance doesn't require us to take money out of our pocket as health professionals to sustain it. We expect the employer to do this on our behalf. It's very, very important. Prof. Chair, as we sit here today, there are other issues that also affect our work as nurses and midwives. Some are direct, some are indirect. Important issues like climate change and taxation have direct effects on our health and the work we do as nurses and midwives. It is the reason why we have incorporated a session on tax and health in one of our plenary sessions for this Congress. We've had some activities on climate change and health in the course of this year, and we'll continue to discuss these issues in the coming months. And even as the world counts down to COP28 taking place in Dubai from 30th November, with fossil fuels and financing dominating the agenda, we hope that our world leaders will do more to reduce fossil fuel emissions and improve the financing of renewable energy. Sometimes we feel these issues are too far away from us, but they are actually not. We are, those of us in Africa, are actually at the receiving end of the impact of the fossil fuel emissions. What are we seeing? We are seeing an increase in heat, increase in rains, and raise sea levels, which are also affecting or destroying homes, farms, and the general property of citizens. Meanwhile, our economies are not strong enough to even properly compensate those who are affected or rebuild those communities in the shortest possible time. It is therefore important that as a country with abundance of sunshine all year through, we begin to leverage on the technology available and incorporate renewable energy in our real estates and work towards having all our corporate organizations use solar energy for their operations. Actually, Prof. Chair, I had the opportunity to participate in the WHO scoping meeting for the selection of indicators to monitor the impact of extreme heat on maternal, newborn, and child health in April this year. It was interesting to listen to meteorologists, physicists, and the kind of data they shared, and the interesting bit of how this data interspersed with the work that we do as health professionals. And the scoping report is available. I will share it with the National PRO to share it on our various platforms. When you have time, read it and learn a thing or two about climate and the resulting impact and how it actually has direct effects on the work we do. So I would want to use this opportunity to join our global partners, namely the Public Services International, the International Council of Nurses, and all others to call on governments to build a climate-resilient health system with research as the backbone. And it's important for us to develop low-carbon, sustainable health systems and help raise the voice of health professionals like ourselves as advocates for a much stronger ambition on climate change. To conclude, Prof. Chair, I wish on behalf of the General Assembly and the entire membership of the Ghana Registered Nurses and Midwives Association to assure all our stakeholders that the GRNMA is well positioned to partner you all on issues related to health, with a vision to building a resilient health system in Ghana and developing a well-motivated nursing and midwifery workforce to improve health service delivery. Long live GRNMA. Long live GRNMA. Long live trade union solidarity. Long live Ghana. Thank you very much.
Wow, thank you very much. Please, let's put our hands together for Madam President, Perpetual Ofori-Ampofo.